Wait for 2 minutes. I'll be right back. We'll start the lecture. Yes, okay. Fine. So till now we have discussed so many things, and today we are going to start a new topic, vitamins. We have already started in the last lectures, but it has been a long time, 2 weeks. So I think every one of you would be not in touch with biochemistry, vitamins specifically. So we'll discuss first of all what are vitamins, which vitamins are their classification, and we are also going to see other new two vitamins. So this is the general objective that we had discussed. Vitamins, as the name suggests, vita means life, something that is very important to life. Jena bagar jivan na chale. That is vita. Yes, so the same thing, vitamins are something that our body cannot produce. Apne vitamins produce nathi kari sakta body ma. We have to consume it from outside. For this, we need the dietary supplements as such, so that our daily requirement of vitamins is fulfilled. Vitamins are organic components in food that are needed in very small amount for growth and for maintaining good health. These were the characteristics. The first was they are required in small amounts. Yes, do not require in grams. They are in micrograms or milligrams. They are water soluble, and also they are fat soluble. So water soluble, they can be easily consumed, but they can be easily excreted also. Fat soluble will be stored in the body for longer period of time. Synthetic vitamins are identical to natural vitamins. Yes, whatever amount of, say for example, diet mathi enough amount of nathi marta apni paase vitamins. So tablets that we are taking, vitamin B complex, C, D, E, all this, we can synthesize them in laboratories, in factories, and yes, we can consume them. It has the same effect as a natural vitamin. Once growth and development are completed, vitamins remain essential nutrients for the healthy maintenance of the cell. The vitamins khali growth na phase much important nathi. Even after the growth is completed, it is needed to maintain the normal health of the body and the cells. Vitamins are helpful for health and life of the body in the following respects. They build up resistance of the body, that is, build up immunity, prevent, cure various diseases, help the digestion, utilization of mineral salts. We are going to see certain vitamins like vitamin D. It helps in calcium digestion and absorption by the cells of the bone. Stimulate and give strength to digestive and nervous system. Some vitamins are essential, say for example vitamin B. For B complex, specifically B6 and B12 are very essential for nervous system. If they lack, there will be abnormal sensations, paresthesia, anesthesia type of sensation. Paresthesia is burning type of sensation. So if a patient is complaining of pain and is not responding to any specific treatment, there are chances his or her vitamin levels may be low, and you need to diagnose that first. The health protection, of course, as we talked about the immunity, so overall health will be monitored through vitamins, and help maintenance of proper health and normal growth. Classification, we discussed fat soluble vitamins A, D, E, and K, and water soluble vitamin B complex and C. B complex is further divided into various vitamins. We are going to see them one by one later on. So there can be water soluble, fat soluble, ADEK, with water soluble non-B complex, that is C, ascorbic acid, and vitamin B complex, specifically divided into energy releasing, homeopathic, and others. Water soluble versus fat soluble. What is the difference between water soluble and fat soluble? As the name itself suggests, the first criteria is water soluble, fat soluble. Absorption is directly to the blood. Water content, the plasma in the blood is mainly water. Yes, so it can easily, vitamins can easily turn to blood and get absorbed. Fat soluble happen via lymph. Yes, lymph node specifically. Transport, they can be freely transported because water can move anywhere in any cell. So with that, vitamins also can move anywhere, anytime. Fat soluble vitamin require carrier. Yes, why? Because they are fat soluble, they require specific protein, they require specific enzyme so that it can travel to and fro from the cell. Storage, they circulate freely, and fat soluble, they are stored in specific tissues or cells. Excretion is in urine, water soluble easily excreted in urine, and fat soluble, they are stored with fat, so excreted also with the fat only. Toxicity possible with supplements and likely with supplements for fat soluble. Both these are when you take excessive amount, milligrams, micrograms ma roj consume karvanu hoy and you start taking in grams. Yes, that causes toxicity. But it is only possible in water soluble, but it is likely with fat soluble. So for fat soluble vitamins, it is much more likely that it will happen compared to water soluble. Requirements every 2 to 3 days, and fat soluble are required every week. Why? Because it is already stored in the body. Water soluble body ma vadare time na rahi sake. It will be excreted through water. So it is required very frequently. Every 2 to 3 days tamare thodu vitamin intake karvu જોઈએ. But fat soluble vitamins on the other hand, they are stored in specific cells, specific tissues, and for that long term you may not even require intake. That is, every week if you take small amount, it will be enough or sufficient. Chemical structure, as we had discussed, no need to remember individual chemical structure, but yes, names, whatever we are going to discuss, you need to remember. So vitamin A and D we had completed. So just giving an overview, vitamin A is a group of unsaturated nutritional organic compound, include retinol, retinal, and retinoic acid, as we had already described. Daily requirement, men and women 600 microgram. Pregnancy and lactation 950, infants 350, and children it requires 600 micrograms. So that is the main dietary requirement, daily dietary requirement, that it should be there, then only your vitamin A level become normal. These were the few sources from which vitamin K can be easily absorbed or we can obtain as human beings. So carrots, papaya, meat, fish, mangoes, peppers, sweet potato, egg and cheese, broccoli, peaches, apricots, melon, avocado, yes, and squash. So these are the main. You can see most of vitamin, whatever we are going to learn, their main sources will be, more content will be in non-vegetarian food. Yes, something that is of animal origin. Why? Because already the animal kingdom is full of vitamins. We are not able to synthesize, but other species can easily synthesize these things, and because of this, we can obtain from them directly, their body directly. Mode of action, dietary retinol esters are hydrolyzed by pancreatic or intestinal hydrolysis in intestine, relating retinol and free fatty acid. Yes, fatty acid and retinol, glycerol plus free fatty acid. So this is a lipid. Carotenes are hydrolyzed by beta-carotene 15,15 dihydroxynase of intestinal cells to release 2 moles of retinol, which is reduced to retinol. Yes, by the reduction process, retinol is converted to retinol in the presence of dioxygenase enzyme. In intestinal mucosal cell, retina is re-esterified to LCFA, incorporated into chylomicrons and transferred to lymph. Retinol esters of chylomicrons are turned up liver and stored, because liver is the main source where the vitamin A is stored. When required, vitamin A is released from the liver as free retinol. This retinol is transported in circulation by plasma, retinol binding protein. So there is a specific protein through which it will transport, and association with albumin. Retinol RBP complex binds to specific receptors on cell membrane of peripheral tissue where it is needed and will enter the cell. Carry retinol, bicellular retinol binding protein and cellular retinol acid binding protein to chromatin, that is DNA. It is mainly vitamin A specifically is useful for vision. Yes, so if it decreases or for the conversion, it requires light energy. So this from here you can see rhodopsin, membrane protein photoreceptor of retina, is converted in the presence of light into beta-rhodopsin. This is converted to lumirhodopsin, converted to meta-rhodopsin 1, meta-rhodopsin 2, and again to scotopsin, which will again move to rhodopsin. Yes, so this cycle continues. This is how the vitamin A will be utilized in presence of light. What is the function? As we talked, first is the vision. First and foremost is the vision. If vitamin A decreases, the blurring of vision occurs. Gene transcription, immune function also is there, embryonic development and reproduction, bone metabolism, hematopoiesis, that is production of blood cells, specifically RBCs and platelets, skin and cellular health, and antioxidant activity. Main is vision. After that is immune function and development. If you remember these three things, that is more than enough. After that, we discussed about the vitamin D, which is a sunshine vitamin. Why? Because it is transferred, or its activated form is only through when UV rays fall onto the body. When vitamin D is referred to a fat soluble corticosteroid, that is a typical type of steroid with a broken ring, found in liver and fish oil, or obtained by irradiation through vitamin D with ultraviolet light, and are responsible for enhancing intestinal absorption of calcium, iron, magnesium, phosphate, and zinc. Yes, so 5 irons. If vitamin D is not there, vitamin D તમારા બોડીમાં નથી, that means these 5 ions will not be absorbed from the body, and આ બધાના deficiency થી પાછા diseases થશે. Yes, all these diseases we are going to see when we are going to see about the minerals. It is also called sunshine vitamin, as we already said. It is available in two forms, cholecalciferol and calciferol. So cholecalciferol, that is vitamin D3, is made up of 7-dehydroxy cholesterol in the skin of animals and humans. Calciferol D2, which is the inactive form or precursor, we can say, is artificially irradiated by ergosterol and is called ergocalciferol. Daily requirement, we need 0.01 milligram. Look at the quantity, only 0.01 milligram. Pregnancy and lactation around 0.01 milligram, and even for infant and children it is the same, 0.01 milligram. The main sources are cheese, margarine, butter, frosted milk, healthy cereals, and fatty fish. So again, non-vegetarian sources are more compared to vegetarian sources, but still it is amply available from the both non-vegetarian as well as vegetarian sources. Mode of action of vitamin D. Vitamin D is carried in the bloodstream to the liver, where it is converted into prohormone calcidiol. Yes, vitamin D directly, which is obtained from the food, moves to the liver. Liver ma jaine tyathi calcidiol banavse. Calcidiol again circulating may be converted into calcitriol, the biological active form of vitamin D in the kidney. So first liver ma calcidiol banse, from that it will move to kidneys, in kidneys it will move form to calcitriol. Following the final conversion step in the kidney, calcitriol is released into the circulation. Directly blood ma circulate thase and જ્યાં જ્યાં જરૂર હશે, specifically intestine, for absorption of other minerals, it will help in the absorption. By binding to vitamin D binding protein, a carrier protein in the plasma, calcitriol is transported to various target organs. In addition to the kidney, calcitriol is also synthesized by monocyte macrophages in the immune system. So our immune system can also form calcitriol from calcidiol. Yes, liver ma je calcidiol form thai che, the immune cells, WBCs, and all the cells present in the blood, present in the body, can move this calcidiol to calcitriol. When synthesized by monocyte macrophages, calcitriol acts locally as a cytokine, which helps in fighting the infection, defending the body against microbial invaders by stimulating the innate immune system. So આના ઉપરથી જ આપણને બે યુઝ તો મળી ગયા. યસ, vitamin D helps in absorption of various ions. Also it will help in immune system. Whether it is made in the skin or ingested, cholecalciferol is hydroxylated in the liver. The reaction is catalyzed by the microsomal enzyme vitamin B25 dehydroxylase. Yes, as the name suggests, hydroxylase. So the process is hydrolyzation. Once made, the product is released into the plasma where it is bound to an alpha globulin vitamin D binding protein. Calcidiol transported to the proximal tubules of the kidneys where it is hydroxylated to form calcitriol. This product is a potent ligand of the vitamin D receptor, which mediates most of the physiological actions of the vitamin. Yes, so no matter where calcidiol is formed from, calcitriol is mainly formed from the kidneys. In the kidneys, as it is also mentioned, proximal tubules of the kidneys. I hope everyone remembers the whole structure of the nephron that you have understood and learned in your 12th, as well as in the physiology. Yes, first and second semester. So the same things are applied here. It will move to the proximal tubules of the kidney where it will be converted to the active form, and the process through which it happens is hydroxylase enzyme will be useful for activating the calcidiol to calcitriol, cholecalciferol. Function: calcium balance, cell differentiation, immunity, blood pressure regulation, and development of bones and teeth. Yes, so this is the whole process from which you can obtain the vitamin D. So you can see free vitamin D directly outside and from the skin forms the vitamin D into the liver. Calcidiol moving to the kidneys, from the kidneys calcitriol moving to the wherever it is required, target organs. And of course the fish, milk, orange juice, diet supplements, all these are the sources of vitamin D as we had already described. So it is needed in calcium balance, cell differentiation. From one cell, two cells are formed. During this process, vitamin D is essential. Also, it helps in immunity, as we already saw, by acting as a cytokine. Blood pressure regulation and also development of bones and teeth. Okay. So moving to the next, vitamin E, the third part. So vitamin E refers to the group of compounds that include both tocopherol and tocotrienols. Yes, you need to remember the terms tocopherol and tocotrienols. Vitamin D is cholecalciferol. The same thing, vitamin E is tocopherols. They are naturally occurring antioxidant. Yes, something that accepts a free electron, that is termed as antioxidants. It is also called anti-aging factor. Yes, so with age, as we already know, our whole body is prone to various diseases, is prone to various changes. The brain size shrinks, the muscle strength, power, endurance, everything decreases. The heart rate becomes lower, heart becomes weak, force of contraction decreases. All these effects, and also the skin, it becomes wrinkles, filled with wrinkles. So these all are aging things. Yes, so to reverse this or to look younger and feel younger, you need to use more of vitamin E in a specific quantity. Yes, otherwise it will lead to over toxicity. So it is also called anti-aging factor. The word tocopherol is derived from toco, means childbirth, and feron means to bear. It is a yellow oily liquid freely soluble in fat solvent. Tocopherol, alpha, beta, gamma, and delta have been obtained from the natural sources. There are 4 subversions, you can say, of tocopherol or vitamin E: alpha, beta, gamma, and delta. Dietary sources: almonds, mustard green, dried apricots, pine nuts, cold pressure plant oils, papaya, green olives, bell peppers, cooked spinach, chili powder, etc. Daily recommendation dose: men 8 to 10 milligrams, women 5 to 8 milligrams, children 8.3 milligrams, and infants 4 to 5 milligrams. Yes, so this is the dietary requirement every day that a normal individual should intake. If you remember, men and women, that is more than enough for all the vitamins, but you should know what is the regular dietary requirement for all vitamins. Mode of action: so free radicals such as superoxide, hydroxyl ion, and nitric oxide all contain an unpaired electron. Yes, the first thing that we talked about in vitamin E, what is the ability to be an antioxidant. Antioxidant એટલે કે કોઈ એવો compound જે એક extra electron ને આરામથી absorb કરી લે or accept કરી લે. તો જે પણ compounds હોય free radicals માં, જેમ કે superoxide, hydroxyl ion, nitric oxide, આ બધા પાસે એક extra ion છે or electron છે. These radicals can have a negative effect on cells, causing oxidative damage that lead to cell death. So શું કામ પણ ઇલેક્ટ્રોન જો ફ્રી રહેશે કોઈપણ સબસ્ટન્સમાં કોઈપણ કમ્પાઉન્ડમાં એ ડાયરેક્ટલી ઈ સેલને ડેમેજ કરી શકે. Yes, wherever it is, it can damage, and it will not damage once. एक सेल ने खाली डैमेज नहीं करे, multiple cells ने डैमेज करશે. Yes. Similarly, antioxidants will be required to maintain or to absorb this electron, and vitamin E is one of such antioxidants. Antioxidants such as vitamin E prevent cell damage by binding of the free radical and neutralizing the unpaired electron. एक electron extra છે, બધે જ એ સેલ ડેમેજ કરે છે. તો શું કરશે? વિટામિન E will absorb that electron. એકવાર absorb કરી લીધું electron ને પછી એ ડેમેજ નહીં કરી શકે. That is how it will prevent aging also. You might have heard of the aging theories, in which one of the intrinsic factors or intrinsic theory is about the free radicals. For example, when vitamin E binds to OO minus or O2 minus, they are form an intermediate structure that is converted to a tocopheryl quinone, which is accepting the electron. After accepting the electron, vitamin E will bind with these compounds. A recent population-based study of antioxidant conducted that a diet rich in foods containing vitamin E might help protect some people against Alzheimer's disease. Now, Alzheimer's disease is nothing but inability of an individual, or we can say normal physiological changes happening in the brain, which lead to shrinkage of the mass of the brain. Overall 2.5 to 3 kgs brain mass is there, that is reduced, and the memory is affected most. Yes, people tend to forget in Alzheimer's disease. That is one of the main symptom, dementia. Vitamin E in the form of supplements was not associated with a reduction of risk of AD. Yes, so when a person is given say for example vitamin E, it helps to prevent Alzheimer's disease. But once Alzheimer's disease is happening or the disease has occurred already, then we cannot help the patient. Yes, then if you give vitamin E, no matter in what quantity, it will not regain the normal function. It will be irreversible change. Function. It will act as an antioxidant, most powerful natural antioxidant. Yes, naturally available, southly powerful natural antioxidant. Free radical scavenger, protects cell membrane, protects LDL from oxidation. LDL is low density lipoprotein. Protection of double bonds in polysaturated fatty acid, prevention of rancidity, and works in conjunction with selenium. Selenium is one of the neurotransmitters which helps in maintaining the normal mood of an individual. Yes, so all these functions are part of antioxidant effect of vitamin E. Vitamin E also plays a role in neurological function, inhibition of platelet aggregation. Yes, platelets to aggregate થઈ જાય તો that can lead to formation of thrombus. That is a collection or a clot, you can say, and that can lead to various signs and symptoms. Clot ક્યાંય પણ તમારા blood vessels માં હમણાં clot બની જાય તો જ્યાં પણ બની જાય, yes, it will block it, અને આગળનો પાથ બધો necrosis થવા મળશે, cell death થવા મળશે બધે. So vitamin E prevents such aggregation. It also protects lipids and prevents the oxidation of polyunsaturated fatty acid. Why it is needed? If it is saturated, more and more amount of HDL will be formed in the body, which is harmful for the body. Yes, so for that reason, it will prevent oxidation of polyunsaturated fatty acids. Okay, any doubt so far we have regarding all the vitamins A, D, and E? Any doubts you have so far? Yes or no, everyone should reply in the chat. Yes, any doubts? Yes or no? Okay, only 5 students are attending. I got only reply of 5 or 6 students. Rest are sleeping or what? Fine. So we'll keep it till here. In the next lecture, we are going to see vitamin K, and we'll start with vitamin B complex also. Okay, so that will be helpful. I don't want to overburden you because already E and K, sorry, D and E will be quite new to you for the time being. We have not covered that much in previous lectures. Okay, have you taken the attendance?
Yes, sir.
Okay, fine. So we'll keep it till here. We'll meet again tomorrow and start with exercise therapy, the leftover portion of PMF. Yes, okay. Hope you have a good day. Be safe.
Thank you, sir.
Thank you, sir.
Thank you, sir.